anybody can, it seems like, get testosterone and men can fix all their stuff, but all of a sudden, like, why does estrogen have this taboo, cancer-causing connotation, and why is it so difficult for us to wrap our heads around that?
It stems from the 2002 study, the Women's Health Initiative, which was the study that scared all women and their doctors. They thought that estrogen was causing breast cancer and strokes and dementia and heart problems. Once that message got out there, people have really had a hard time moving past that, even though it's been disproven many times over in the last 20 years.
As a hormone expert, like, what do you try to avoid in your daily life?
I mean, I try to do the easy things, like don't put plastic in the microwave. My son is 15 and he's always we have some plastic plates and he's always micro. I know. I told him, I'm like, I'm Mars. I'm going to take those away from you. You're hurting my grandbabies.
Guys, I hope you listen closely on this episode too. You don't have to have a vagina to benefit from helping the women around you.
That's right.
Too, and support and understand, because knowledge is power, and I know that once my fiance and I got aligned on my cycle and, we understand and we have more knowledge, now he's like helping out his friends who are going through it with their women. He's like, well, what time is it in her cycle? They're like, what? What does that have to do with anything? Welcome to the Built for Growth podcast, a place that I have dedicated to motivating, empowering, and elevating you through knowledge and shared experiences to be the best version of yourself. So come along with me and my amazing guests who are here to inspire you and I in all the ways. If you are ready to grow above and beyond, then this is the podcast for you. Today's episode features a hot discussion, as in hormone optimization therapy, HOT, hot, with my guest, Dr. B Killen, who is a leading physician in regenerative medicine, sexual medicine, and hormone optimization, a board-certified emergency physician turned longevity specialist. She combines cutting-edge treatments such as stem cell therapy, hormones, and peptides with practical lifestyle wisdom at her clinics in Utah, Florida, and Texas, while sharing her expertise through international speaking engagements and educational content creation. Dr. Killen and I focused on hormones and women's health specifically, which is something I have been wanting to dive into because there are a lot of misnomers about estrogen, like the fact that it does not cause cancer. So why the fear around prescribing estrogen? Something that can help so many women transition through perimenopause and menopause, and its role in sexual health and its beneficial factors like preventing heart disease in women. We get into that and so much more. This episode is awesome. So as always, thanks for listening. Hi, Amy. Thanks for coming on Built for Growth. I'm so excited to have you here, and I hope that you had a good flight in. You said it was pretty quick and easy, yeah?
It was super fast from Salt Lake to here, so I'm excited to be here.
Yeah. How's the heat?
It's hot here. Definitely 100 today, but it's not. It's actually hot in Utah as well.
Is it only 100 right now?
It said 100 when I got off the plane. So
yeah,
it's
going to get hotter. When you leave here, it'll be hotter.
Great.
So good. Well, I'm really excited to talk to you today because I haven't had the opportunity to talk much about women's hormones, and I think this is just it needs to be discussed more. It needs to be talked about more. And something that you heavily promote is that every adult vagina needs estrogen. And I'm like, this is great. Like, yes. What a great one-liner is that? Because there's such a misnomer, I feel like, about that. It's like, oh, yeah, well, we know that penises need testosterone. That's a no-brainer. And anybody can, it seems like, get testosterone and men can fix all their stuff. But all of a sudden, like, why does estrogen have this, like, taboo, cancer-causing connotation? And why is it so difficult for us to wrap our heads around that women need estrogen? We
do need it. I think it stems from the 2002 study, the Women's Health Initiative, which was the study that scared all women and their doctors. Because they thought that estrogen was causing breast cancer and strokes and dementia and heart problems. And it turns out it doesn't cause those things. It was actually the progesterone that was the problem. But I think once that message got out there that estrogen causes breast cancer, especially, people have really had a hard time moving past that, even though it's been disproven, many times over in the last 20 years.
It's so funny. That reminds me of this, I think it was my fourth podcast near the beginning of this journey for me, and I had Gary Reinl on, who's the anti-Iceman, and it's a similar thing with, like, icing locally. That is just something that has been disproven over and over again, but it's still just this idea that's lingering in everybody's minds. Soccer moms, what do you do when somebody rolls their ankle? Well, you throw ice on it. Sure, it can be great for pain management, but it doesn't do what you think it does. Like, it doesn't remove inflammation. If anything, it just kind of slows the process down. Okay, so what are the benefits that women get from getting the right amount of estrogen? I think that's important too. I mean, you don't just give someone estrogen. There's an amount, right?
Yes, absolutely. So women don't usually need estrogen until they've stopped cycling. So whether you stop cycling because you're breastfeeding or you're heavily training and you stopped having periods, or you've hit perimenopause and menopause and you just stop cycling. But once you stop cycling, then usually estrogen and progesterone have gotten pretty low, and that's when we think about replacing both of those hormones. But I mean, estrogen, there are receptors all over your body. Every tissue in your body has estrogen receptors: your brain, your blood vessels, your bones, certainly your muscles. And so when you lose estrogen, it's a major hormone for women, and it's kind of starts to cause like the breakdown of all of these different systems when you lose estrogen. And so it's important to at least think about replacing it for that reason.
Okay, so how do you determine, how much estrogen somebody would need, and in what way do they take it? Because I understand that there's multiple ways for someone to, utilize estrogen.
Yeah, there's most commonly it's given through the skin, transdermally, like creams, patches, gels, things like that. But there are estrogen patches or estrogen pills. The most important thing is that you take a bioidentical estradiol, or body identical, it's also called, which just means that the chemical structure matches what your body makes. So it's not some kind of weird, other combination of things. So that's the most important thing about it.
How do you determine that? I mean, and where do you get something that's bioidentical? I mean, you're talking about, is the version of estrogen that I make or estradiol different than the version that you make? I mean, is it that much of a nuance, or is this just kind of, okay.
Good question, though. So estradiol is the actual name of the chemical structure that you want. So that's what you make. It's the most important estrogen in your body, and me as well. And so what we do is we want to replace that with estradiol when you go through perimenopause, or even if you're just breastfeeding or whatever. And there are other versions that are not called estradiol. Like there's one that's called conjugated equine estrogen. That's Premarin. That's actually made from pregnant horses' urine. It's a horrible process, but it's also not as good for you. So the key is just getting estradiol. And it's a prescription, but any doctor can write the prescription. They don't all want to, but they can.
Yeah, there's still a lot of doctors out there that are scared to do this, right?
Yes, there's a lot of misinformation still, even though it's been 23 years.
Yeah. So, what is the holdup, and why do you think that doctors aren't up to date on this? I mean, it's 23 years. Come on, why are they not up to date on this?
I think there's a few things. One, I don't think any part of medicine has really taken ownership of this type of hormone replacement. Certainly you'd think gynecologists and OBGYNs would do this, and they did it for a little while, but they haven't really continued to learn about this. And so there's not one field of medicine that's like, okay, I'm going to do that. And it's not being taught in medical school. It's not being taught in residency programs, even now. And so part of it is just getting doctors to realize that these hormones, when you lose them, they affect every system in your body. I mean, they affect how your brain works, how your skin ages, how your pelvic floor works. And so really all doctors should understand how these hormones are affecting their system and be able to replace them. But unfortunately, it's not being taught to really many doctors.
Okay. There are 3 times in my life when I have not had a cycle, and 2 are obviously, causal of each other. It's one time when I was pregnant. So, I mean, does estrogen dip low when we're pregnant? I mean, is this part of the mood swings?
During your pregnancy, your hormones will actually go up higher. Okay. But then right afterwards, if you're breastfeeding especially, they kind of crash down for a little period of time.
Okay. So, a breastfeeding woman, so I did not get my cycle back until about 6 months after because of breastfeeding.
Yeah.
So in that time, would you, if you were working with me, you're like, okay, Miesha, you're not cycling, do you take a blood draw and you kind of see it's low? Do you always know it's low? And would you recommend then would I have been a candidate to take that?
So you would at least be a candidate for vaginal estrogen. And the reason for that is it's a very low dose and it just kind of stays in the pelvic floor. So it doesn't get really into the rest of your bloodstream. So it's not going to affect, the breastfeeding or any of the other hormones in your body. And it's very protective for helping to keep the pelvic floor healthy, help to prevent dryness, also prevent UTIs and recurring UTIs and things like that. So it's super safe for all women. So I would at least do a low dose vaginal estrogen. Most women who are breastfeeding don't need the other hormones, but certainly you can take progesterone can be helpful for postpartum depression sometimes, and it's safe when you're breastfeeding. Usually we just kind of wait on the other hormones until you get into perimenopause or menopause.
Okay. So, progesterone, that's I don't think that I fully understand progesterone because I feel like when progesterone is present, I have the most difficult time in my cycle. It's the most challenging for me. It's definitely the time when I don't want, my fiance to bring anything big to the table. Like, don't ask me to make any decisions right now. Like, I just want to lay low.
Yeah.
But I also don't like the fact that I don't operate as well at that time as I do during other times. Maybe after the first 2 days of my cycle, I'm feeling pretty good, and it's like then I get into into the testosterone phase and ovulation, and I'm feeling great. And I don't like to have to slow down, even though I feel like that's really what my body's asking. It's kind of asking me to delegate, relax a little bit. Maybe that's when I go and get a massage, go get a pedicure, kind of just offload a little bit.
Yes.
It's hard to do, right?
Yeah.
Because we're who wants to slow down? Nobody likes to do that.
But it is. I mean, progesterone, it's highest during the second part of your cycle. So from ovulation until your next cycle starts. So that kind of what we call a luteal phase. And it is. It's kind of wanting you to calm down. It's it's an anti-anxiety for some people. It can help you sleep, progesterone, but it can also make some people a little bit too groggy or a little bit too. It can have too much effects on some people. But it is a time where you don't have to change your life too much, but I think listen to your body. And if you want to go get a massage, that's a great time to get a massage.
Yeah. I mean, I certainly think those little things help me feel like I'm doing a little bit to take care of myself and my mental health and my emotional health. And that's just it's a good time in the cycle to do that for me.
Yes.
And I think a lot of women, once you get to know how the hormones change, it's a nice time to prioritize a little bit of self-care.
Absolutely.
Anywhere else in the month.
Yeah.
But okay, if you're saying that progesterone has all these positive things, because again, I look at it and I'm like, oh great, here's that week. Here's the progesterone wants me to chill the fuck out. And I don't want to. I want to be in the testosterone phase, and I just want to feel great, and have the libido and all those things. So sometimes I think we as women kind of dread that week that's leading into the cycle and maybe the beginning of the cycle. And is it that progesterone is there, or is it that there's a bottoming out and a transition of hormones that's actually, causing, I don't know what you'd say, mood swings, or some people label it PMS or different things like that?
So it's a few different things. So first of all, some women love progesterone. Progesterone is very it's really calming. It makes them feel less anxious. They love it. But other women have the exact opposite reaction to progesterone in their brain. The progesterone actually causes activation of the GABA receptor, but for them it's excitatory. So it actually makes them they're anxious, they can't sleep, maybe they get migraine headaches, or they get PMS or PMDD. And so progesterone is this double-edged sword.
What's PMDD?
It's premenstrual dysphoric disorder, so it's kind of like PMS on steroids.
Okay.
So some women do great with progesterone, some really do hate it, and so it's very hard to figure out, what's causing symptoms in women, in that sort of week or two before your period.
Okay, so when you take this exogenously, though, does that necessarily have a different effect than our body's natural progesterone? So let's say that I'm someone that progesterone causes a little bit more anxiousness and I don't really love that feeling. Is that going to be something that I'm going to experience every month because of my own biology and the way that I receive my own progesterone in my body?
Yes.
Okay.
Usually, and it's interesting when you take it exogenously, so I give you a pill, for instance, some of those effects are more pronounced because the way it gets metabolized into your liver, and some of those metabolites actually cause some of the brain effects. There are other ways to give progesterone. I can give it to you as under your tongue. It's given as a cream sometimes. So vaginally is actually a great option. So we can give it in a different way to minimize the effects. But depending on kind of what's causing them, some women do have a hard time with progesterone, either whether they make it themselves or whether I give it to you, like in menopause, for instance.
So the different ways of administering it, that was interesting to me because you were talking about how, the vaginal estrogen kind of stays a little bit more locally. But when we eat something, it definitely has this gut-brain connection, right? It's interesting how food works, how, an ibuprofen works. It's we put it in our stomach, but it affects our brain, So when we talk about putting it on our skin or anything like that, how do we see a difference in the way that it affects the brain?
So with hormones, any hormone, we can give them either they can be locally acting, where they just stay where you put them, whether it's your skin, your vagina, or they can be systemic. They can affect the entire body. And really it comes down to dosing for that. So like essentially I could put a little bit of estrogen on my skin. If it's a very low dose, it'll generally stay kind of at my skin. If it's a higher dose, the skin will absorb it and it'll go throughout my whole body, including the brain. So it's with hormones, it's mostly about the dose that you're giving, because you can give vaginally and it can affect your whole body, or you can give it vaginally and it could just stay in your pelvic floor, but it's about the dose.
Okay. Very interesting. Okay. The other time that I lost my cycle, other than being pregnant and breastfeeding, amenorrhea. So I experienced that 2 times in my career. And I've been very interested to understand what happens when we lose our cycle due to, extreme physical activity and or, extreme calorie deficit, which I think there's a little bit of both. It's not that I'm still eating, 2,000 calories a day, which seems like a lot probably to some people, but when you're burning so much, you're still on a calorie deficit for potentially an extended period of time. Okay, so one time I went down to 125 pounds, which normally I fight at 135 pounds, and the UFC one time was like, why don't you try 125? And that just ended up being like 6 months of really hard work to get me down, because I had to lose a lot of muscle, already fairly lean at 135. I'm usually like 19% body fat, which I feel pretty good at usually. I think I was down to like 13% when I made 125. Oh, wow. So it was quite a big difference. And then I lost my cycle for a few months, and then it came back, but took a long time for it to feel somewhat normal. Yeah. And this is interesting because you think, and I've heard this from other hormone specialists and doctors that, men are easier to kind of fix, quote unquote, in there a little bit more. Like Dr. Minnie Pels talks about how men are on a 24-hour hormone cycle, right? And we're on a 28-day. So even in 1 year, I've only had 12 opportunities to redo the cycle. Right. Which is not a lot. Yeah. Right? Yeah. So, anyways, it took a long time. I never ended up taking anything, than just trying to correct my body or just let it figure it out. But that was kind of painstaking, if I'm being honest. And it wasn't fun. Yeah, it's when you're whether it's overtraining or caloric restriction, like you said, it's a lot of stress, like on your body, right? Mm-hmm. Mental, physical, and essentially you're sending your brain receives those messages and it's like, yeah, you know what, we're gonna prioritize like survival mode, and we're going to deprioritize having cycles. And so it's essentially basically your body's telling you you're not fit to you're not ready to have a baby right now. Your brain is like, we actually are not in a good spot to have a baby, and so it shuts down your ovaries from being able to make these hormones. And that is one of the kind of things, I've had patients who have been amenorrheic for years, whatever cause. And those are patients that we do, get them cycling again. That's the best thing you can do. But if they are not cycling, then replacing, especially estrogen in those patients, is really important, because, you're losing bone mass. If you go 3-6 months or so without estrogen, you start to break down bone. And so for you, it wasn't probably a big deal because you're training a lot and you're stimulating bone. But it can be a big cause of osteoporosis, even in young women, because if you're not cycling, then there's a problem usually, if you don't know why you're not cycling. Yeah. Are you able to explain what happens when we're not cycling? Like, you said that your body shuts down like the production of estrogen. So what state are we kind of living in then? Am I living with like more progesterone? Do you know where I'm at in that? And, like what? I've been very curious, because when it comes down to cutting weight, I don't like to do that right before my cycle. I try to prioritize, if I can have any say, or shift my cycle in any way, which is not very easy to do, obviously. But if I can time a fight to where I'm more towards the middle of my cycle, it's just better, as far as like, pretty sure the weight cut's not going to have any hitches. I'm also probably likely to perform well. Yeah. But if you enter a state of amenorrhea, which again I experienced in this most recent fight of mine, which I haven't, to my knowledge, experienced making 135 pounds before. I'll give you a little precursor though. I had a knee injury, so I tore my LCL and my PCL, and so I was out for about 14 months. Ugh. And then I signed a fight, and I went straight into a fight camp, and so I had more weight to lose than I normally would have had I been able to have my normal active regimen. So I was making a bigger drop in weight. And again, I think that kind of simulated a similar situation: high output, lower calorie, and the body just went, we know what you're doing here, and we're going to shut this down. So where was my body living And where were my hormones?
So when your ovaries are kind of shut down, so the brain stops sending signals to the ovaries because the brain's like, yeah, we're not going to get pregnant. So your ovaries essentially stop making estrogen and progesterone, estradiol and progesterone. And your body still makes some estrogen from other tissues, like your fat tissue, for instance, your adrenal glands. You can get a little bit of estrogen from those
and if
areas.
those go low, then
But
does that?
I mean, if people who have low body fat, you're not making very much fat, estrogen from fat, and so if you tested your estrogen levels, they would have been very low. Normal for a cycling woman is probably between about 50 and 400, depending on when you're in the cycle, and in menopause they go down below about 30. But if you tested your levels when you were amenorrheic, they would probably be less than 30 for estrogen. So essentially, it would have looked like menopausal estrogen and progesterone levels for you.
Okay. And does that, what are the symptoms for women when they're experiencing this? I know that at some point I have, menopause to look forward to, which I'm sure is, it doesn't sound like it has to be as terrible
It doesn't have to be terrible.
Right. It doesn't have to be terrible. And I think you have some great, concepts and solutions to not having to have it be so awful. But, what are women experiencing when these hormones just kind of take off and, we're just kind of left to deal with the aftermath?
Yeah. It's interesting. For men with testosterone goes down slowly, gradually, starting at about age 30, 35. And so it's kind of a slow march down. But for women, generally during perimenopause and menopause, it's like falling off a cliff. Like your estrogen, progesterone were pretty normal, you're cycling, and then all of a sudden over just a couple of years, they just kind of crash down. And so, the initial cycle symptoms are usually from low progesterone because that goes down first during perimenopause. And that's things like difficulty sleeping, more anxiety, feeling anxious. Sometimes weight gain will start then as well. And then as you get closer to menopause, which is estrogen is also falling, then that's like your classic, hot flashes and night sweats, but also like weird things like joint pain. Like when I first started, I'm 49. I was like, how old am I? I'm 49, perimenopausal still. But when I first started noticing for me was I was waking up with like my body, like super sore body. Like I had just competed in like some sort of like, MMA fight the day before or something, which by the way, I don't fight. But like that's how I felt. Like it was so like a crazy workout, but I hadn't been doing anything different. And so that was happening every day. Just a lot of soreness, joint soreness, muscle soreness. And that's one of the symptoms of estrogen going down is your body is like all your little cells are screaming like, what's happening? So there's like 30 symptoms, but those are some of the common ones.
What about the mental and emotional state of a woman who doesn't have estrogen or progesterone?
Yes,
is available.
It's not great. Estrogen, progesterone, and testosterone, all of those are really important for brain health.
Does testosterone go down when women go through menopause?
It's been going down since about age 30, 35 for women also. So it doesn't drop off as quickly, but it is kind of continuing to march down. And all of those are important for brain health. And and certainly we see, estrogen specifically causes a lot of what we call brain fog, but that essentially means everything from memory problems to focus, problems focusing to, difficulty with word finding. A lot of people can't find words to,
that explains men.
concentration
They don't
issues.
talk at all. They don't have barely any estrogen. This is why we're so wordy, right?
So so your brain kind of starts to turn off a little bit. Like in fact, we see the brain energy production during perimenopause, like the actual amount of energy your brain is able to make goes down by 30%. So it's like a light bulb was bright and you're functioning, it's great, and all of a sudden it dims by 30%, but no one tells you it's coming and you're still trying to do all the things you were doing, when you had a fully bright brain light bulb.
This is so interesting. So I wonder how, I'm just curious, and I've been so curious about how, when I am experiencing amenorrhea, it may or may not affect an athletic performance. And I don't know if you have any thoughts on that. I don't know if there's even studies on that. I think that women generally are lacking a bit in information and studies.
Yes.
Yeah.
I don't know about that. I haven't looked into it. I would imagine that there's probably some effect, but I don't know. I don't know what it is. Certainly, a drop in testosterone would affect you, and that's why probably you feel so good when you feel good fighting near ovulation, because your testosterone, that's when it goes up the most, is right before ovulation. But I haven't seen studies on that. That's a good question.
Yeah, I would be interested, and I wonder how it affects. Do you know if amenorrhea affects the testosterone?
It can affect it, but it's not going to go away completely because you're still making it. Your adrenal glands are still making it. So it's kind of like menopause. Like it doesn't fall off a cliff like the other ones do.
But it's not, but you're not getting the peak of like an ovulation or anything like that either.
Yeah, exactly. You're not getting the same waves of same cycling that you would before.
Yeah. I remember like how I felt during those times was a little bit like going through the motions, not fully alive, And because I had gone through that before in making 125 and then in this most recent fight when that happened again, I was like, oh man, okay, the cycle was just not showing up, and I was like, we're 2 weeks out and it's not here, and it's just like every day went by and it was just like not coming, and I was like, okay, so we're just gonna have to mentally make a shift, and we're gonna have to make a decision that we have to mentally try to override the feelings. Easier said than done. I still think that there is some impact on performance, but I do think that it helped a ton having some knowledge and experience going through this before and saying like, I'm going to decide because I know in my conscious brain that this is a very important moment to me, and I could still have to like I had to try to muster the I don't know how to say that, like the not desire, because I did want it, but like, that energy towards it, like when you just feel a bit like you're just tired and you're running up a hill and you're just exhausted and you're slowing down and you're just trying to like mentally battle yourself to like not stop in that moment or not give up, just like keep going. It was kind of like that for me.
Yeah. No, that makes sense. I mean, I think that it was probably easier knowing that it was going to come to an end. Like it wasn't going to be forever. I would imagine, like, it's like, in 2 weeks I get to start, eating more normally or training less hard, and it'll come back. I think that, a lot of women, they have these disrupted cycles from whether it's from sports training or something else, PCOS or other, disorders, and they don't know what's causing it, and their doctor maybe hasn't looked into it, and they don't, no one has told them that irregular cycles there's a problem of some sort, and so we have to figure out what's going on. But they feel awful, like they don't have the normal hormones in their body. They have too much of some, not enough of some, and they don't know what's going on. And it's there's no end in sight that's going to be like, oh, in 2 weeks I'll be better.
Yeah. Does estrogen affect libido?
Yeah, it does. Estrogen affects, when we think about like kind of the sexual, I call it little sexual snowman. There's essentially at the top is desire, and then there's arousal, and then there's orgasm. And those are kind of the three kind of phases. And estrogen and testosterone affect all three of those phases. And then progesterone actually affects arousal as well.
Okay. So if you're low in estrogen, you may be experiencing, like, one of the symptoms is like a low sex drive.
Yeah, absolutely. And also low arousal. So the blood flow is the arousal part. And you have less blood flow to the pelvic floor when estrogen is low. So estrogen is kind of like Viagra for women. Viagra, obviously in men, increases blood flow, and it works by a pathway called a nitric oxide pathway. And estrogen in women actually also works on nitric oxide and also increases blood flow. And it also helps to keep the tissue healthy, the vagina and all the other tissue around it. So estrogen is, for women, estrogen is Viagra.
What about the heart and estrogen and blood vessels and those things? I mean, we talked some about bone health, but can you kind of dive into those things, like what else is important about having estrogen, and like when should women around, perimenopause, like when should they be thinking about maybe getting their first test, and kind of dive into that.
Yeah, I mean, estrogen is really important for blood vessel health, and we know that it helps to prevent plaque in the artery, so it helps prevent atherosclerosis. And the reason that one reason that women don't get heart attacks as quickly as men, we're about 10 years delayed usually, is because we have that protection from estrogen. And we also know that from multiple studies, more than 20 big studies in women, if you give women estrogen early in menopause, so usually within 10 years of menopause onset, then it reduces her risk of getting heart disease by about 30 to 50%.
Wow.
Which is a big number, especially since heart disease is the number one killer of women. So if you can reduce heart disease by 30 to 50%, you're reducing overall mortality rates in women. And we've seen that in studies too. It's about a 30 to 40% reduction in mortality rates during studies.
Wow. Okay. So is that at all too because of the body mass difference? Like, I feel like sometimes when women go through menopause, we see more weight gain, right? And sometimes it seems like it's more here in the middle section, or than maybe it would have been when a woman was cycling. I know that that's something that my mother complains about. And I hear a lot of women, oh gosh, it's like my mid area. It's like
Yes.
they don't have that tiny waist as much.
Right.
It seems like. Okay, so did you think?
So what happens is estrogen helps. So estrogen promotes weight to live like in your hips in women, right? Like the hourglass figure kind of thing. So when you lose estrogen, the weight starts to move to the belly, just like you said. And so we see like more of a belly, and it also moves to like the deep parts around our organs. So you get what's called visceral fat, which is this like inflammatory, it's like bad fat. Like it's the kind of fat that's sending out signals to the body that's actually making you less healthy. And so that visceral fat is another risk factor for getting heart disease. And loss of estrogen also can cause your blood pressure to go up. It causes your lipids, so your cholesterol, to go up or go in the wrong direction. And so basically it does all these things that also contribute directly to heart disease, which is why it's so important to think about replacing estrogen if you can.
I have a friend of mine who she just turned 40, and she went and saw her doctor, I think her gynecologist, and she said, hey, I'm 40. I'm not having any, menopausal symptoms yet, but I know that I'm getting a little bit close to that age, and I just kind of want to know is there anything that I should be thinking about, considering, or doing to kind of stay ahead of the curve, or, be in a good situation when menopause comes.
Yeah.
And her doctor looked at her like, you're not going through menopause? No. Like nothing. There's nothing. And she felt very kind of dismissed. She's like, I'm not really happy with that answer. I wanted to know, like, of course, there's always things that we can do. We call it as athletes like prehab. Like you want to prehab something so that you don't get an injury, so that you don't have something you have to take care of after the fact. You want to try to be healthy before. What would you say to something like that?
I mean, I think asking the question is important. Like just looking ahead and seeing what's coming and what are the symptoms, what should I look out for? Because menopause can start at 40 or 45, even though 50 is more common. It can start earlier. Always making sure you have a doctor who's kind of ready to like guide you through it, if you can. Getting some blood testing. I mean, the hormones are still fluctuating a lot when you're in your 40s, like estrogen, progesterone are up and down. They may not be super helpful, but other hormones like FSH and testosterone and some of these other hormones, thyroid can start to change. So just getting like some good baseline testing at least once a year to make sure that things are kind of stable, and then that way your doctor can say, hey, I'm starting to see some changes in your labs. And you can start working together on deciding whether it's time to be adding, hormones or not. And the doctor will also be able to help you say, here's what's coming, here's what you do when your cycles start to become irregular, or here's what you don't do, or, things like that. So having that relationship, I think, is super important, and also really hard because not all doctors don't know, how to do this stuff.
Right. Yes, I think clearly we're seeing that more and more. And I also love the one, when it's just everything that could potentially be wrong with women gets blamed on menopause. Like I feel like that's also another common and very dismissive. Oh, it's just menopause. You feel terrible. It's just part of it. You just got to deal with it.
It's just part of aging. Go have a glass of wine and just try to relax.
Yeah. It's like, it's like, oh my gosh, how terrible. Like just sending these poor women home with like no solution. That's why I've been very excited to talk to you today, because I think it gives a little ray of hope for any woman that's going through a difficult time, transitioning, or just getting that thought out there for, even myself, just like knowing that there are things that we can do. So speaking of that, are there things outside of taking the hormones that also help? Like, do you recommend certain other things that maybe either help the hormones once you've started taking them, or just good lifestyle things that help with their hormones?
Yeah, I mean, certainly all of the normal lifestyle stuff is going to be important. Like it is every stage of your life. I do think that especially as you get closer to perimenopause, menopause, sleep becomes even more important. And then for women, keeping muscle mass or trying to gain muscle mass is even more important, because we know that, as you lose estrogen and as you get older, then you start to lose muscle mass. And that's obviously one of the big risks for falling, for breaking a hip, all of these things. So I tell my female patients, like, certainly, get some cardio, go for walks, do some HIIT training, but as importantly or more importantly, hit the weight room.
Yeah, lift some heavy things.
And lift some heavy things, because that is the part. And I think that even now, even still, a lot of women are scared to lift heavy weights because they don't want to get bulky, which we know is not a problem. But that's something that I still hear from patients.
Yeah. By the way, that's almost impossible to do.
Yeah.
Like I mean, and I say that coming from from myself as a woman who's a bit more muscular, but I train like a mad person, and I lift all the time, and I lift people all the time.
Yeah.
And it's like, okay, so this is as bulky as I've ever gotten, with like that being like a
Right.
huge ask of my body to be strong.
Yes.
You're not going to get overly bulky by going and doing a normal like workout, which just means like, you do 3 sets of, like a heavy lift, and, 3 sets of 6, like 3 sets of 8, 3 sets of 12, whatever. You're
Yes.
not. You're going to look nice and toned.
Yeah. And it does become harder. I mean, I've had, like, the last few years, like, I've had a harder time just maintaining muscle. So it is important, I think, especially, whether you're 30 or 35 or 40, before you get into perimenopause and menopause, start thinking about growing some muscles, and then, like, how am I going to maintain these muscles? Because it is harder later on to grow them. And it just keeps getting harder as we get older.
Yeah, absolutely. You mentioned PCOS earlier. Can you tell me a little bit about what that is and what you've seen with some of your clients that have seen a benefit from taking
So
estrogen or whatever?
PCOS is polycystic ovarian syndrome, and it's kind of a misnomer. The name isn't a great name, but essentially it's named because sometimes you get these cysts in your ovaries. And so that's where it came from. But essentially what it is, it's an endocrine disorder that is usually you have insulin resistance, so kind of like diabetes or prediabetes, blood sugar regulation problems. And then oftentimes you have high androgens, so that's like testosterone, for instance, so high testosterone symptoms. The problem with it is that you can have it's very difficult to diagnose, and most women, many women who have it are not diagnosed, and so they're having irregular cycles, or they're infertile, and they're having fertility issues, and they have no idea why, and the doctor is not diagnosing it because they don't have like classic symptoms, and so they'll go years like that. Whereas if we know what's causing it, we can actually there's some medications we can use, there's some supplements we can use, there's certainly lifestyle changes they can get you back to cycling, and then feeling better. And also you're able to have babies if you want to.
Do you lose more eggs in the one cycle, like 1 month with PCOS? Like you lose, or no?
I mean, I don't know. That's a good question, actually. I don't know if you do. And not everyone who has PCOS is going to even have those extra ovarian follicles.
Okay.
What's interesting about just all women, we only ovulate 1 egg a month, right? We release 1 egg. But there's up to 1,000 eggs every month that start to mature, and then they just die. And
What?
so this is why by the time you get to be age 50, you're out of eggs and out of
What
these
happens
follicles.
with those other eggs?
They kind of start their process, and instead of finishing, because you don't need 1,000 eggs.
Yeah.
But that's one of the reasons. That's one of the things that's being researched, is how can we slow down the number of eggs that are just dying needlessly as we go through? Because if we could do that, and we could push menopause out 5 or 10 or 15 or 20 years, because you still have eggs to make the hormones, then all of a sudden we're going to have a bunch of women who are much healthier for much longer. So it's a kind of an interesting, fun thing.
So is that really what determines when menopause starts, is basically when
Yes.
you've emptied the eggs?
Yeah, because it's actually the cells around your eggs. These are called follicular cells that make the estrogen and progesterone. And so as long as you have more than 1,000 eggs in your ovaries, then you're able to make enough hormones to cycle. Once you get down to about 1,000, and this is like you had millions when you were born. Once you get down to 1,000, that's when menopause starts. So a lot of the kind of new ovarian aging research is looking at how can we slow down all this waste. We're wasting all these follicles, every month while we're cycling. And it's interesting, even if you're like people who are on birth control, even if you're not cycling, unfortunately, that still doesn't affect, you still have the ovaries aging at the same rate. So we haven't figured out a way to slow it down yet.
What about women who donate eggs and have a bunch of them like sucked out? I don't know how many are able to be, but would that have any impact on it? It's probably not that many eggs.
No, I don't think fertility treatments have a big effect.
Okay.
I mean, I'm not a specialist, but from what I understand, the biggest things that can cause hastening or maybe increased speed of ovarian aging, which we don't want, the biggest thing is smoking.
Okay.
So smoking is very bad for your ovaries because it's bad for the mitochondria. It's bad for all of it. And then we're seeing also a lot of the endocrine disruptors in the environment are starting to affect how quickly the ovaries age. Women who are exposed to more toxins and more endocrine disruptors in the environment, we're seeing faster ovarian aging in those populations as well.
Ooh,
So don't smoke.
Yeah.
And I don't know how you avoid the endocrine disruptors because they're everywhere. But
Yeah. Or is there anything that you like, personally could share that you, as a hormone expert, like what do you try to avoid in your daily life?
I mean, I try to do the easy things, like don't use a lot of plastic, don't put plastic in the microwave. My son is 15 and he's always we have some plastic plates and he's always micro. I know. I told him, I'm like, I'm Mars. I'm going to take those away from you. You're hurting my grandbabies.
Because it's for men too.
Exactly. It's bad for men. So just avoiding as much plastic as you can, especially in the microwave. Avoiding like Teflon and the nonstick pans and the things that have a lot of those other chemicals in there. Filtering your water if you can, some simple things like that, starting with those things. And then certainly you can go crazy. There's all kinds of things you can do, but like I could at least get some basics down.
I get crazy. You mark me on that side for sure. I get crazy about these hormone disruptors and I try to be more organic and, but even then, I mean, there's a lot of pesticides and things that's allowed on organic food that's not even allowed on, so it's just like you can't totally win. That's why I just need to buy a big piece of land and start a homestead and grow my own food and,
Yeah, well, invite me to your homestead when you get it.
I will, absolutely. Oh my gosh, this is so interesting. I feel like there's so much that we could unpack here. So what about women who are not cycling because they are on some kind of like a birth control and, is there a benefit to cycling and what is it? And should women be aware of that when they start, something that's an elective way to stop cycling?
There's a lot of kind of controversy in the medical community about birth control pills, and I was on them for 15 years or something. So I think that there are some benefits certainly, which is you don't get pregnant if you don't want to, which is great. I think they can be useful also, people who have a lot of pain or vaginal bleeding or things like that they just can't control, PCOS sometimes.
Yeah.
But I think that there are a lot of things that we're missing when you shut down, because birth control pills shuts down your entire hypothalamus pituitary axis. Essentially, all of the hormones that are going to your ovaries and all those hormones are shut down.
Would this explain why some women experience big mood shifts or they describe it something like a depression?
Yeah, because you're getting synthetic hormones that are much stronger than your own estrogen and your own progesterone. So you're getting these other hormones that are kind of like they're like masquerading as your hormones, but they're a lot stronger at the receptor. So they're shutting down your own production, but then they're binding to your receptors really strongly. And so some people are just very sensitive. You can get weight changes for sure, mood changes, depression, anxiety, those kinds of things for sure. There is some research that if you're on those birth control for long periods of time, it increases your breast cancer risk. Now it's not a huge risk, but anything that we can look at. So I think it's always worth talking to your doctor. Like, are there other methods that would work better? Like, what are the risks? What are the benefits? There's an increased risk of blood clots with birth control for sure. But then some women do fine on it and have no problems at all.
Yeah, I took birth control for a few years, and then I had a hormonal IUD, Mirena.
Mirena, yep.
And then removed that, got pregnant, and then after my second one, I got a copper IUD. So copper IUD, of course, there's always pros and cons with anything that you do. But I was like, well, I don't really want to do anything hormonal. I want to try to be more natural.
Yeah.
But I've since learned, which nobody told me this when I went in to get on birth control, as a young woman. Nobody said that, well, you may want to consider this. Well, because we know why women usually go in for birth control. It's one of two reasons. Most commonly, not to get pregnant.
Yep.
Or they have terrible cycles.
Yep.
That are painful and they can't function and they need to not have that experience every month because it's debilitating.
Yes.
But I don't feel like the doctors sit down and tell you, well, there is a benefit to cycling, just so you know. If you're using it for this reason, you may want to consider letting your body cycle again at some point, or because We understand like calcium gets kind of like it's good for your bones, right? When you cycle. I mean, what are some other benefits?
It is good for your bones. You are getting a synthetic estrogen, so you're still getting like you're
Okay.
not going to have like bone breakdown on birth control. Usually, it's not. That's a good thing about it. But there's a lot of there's some people who think that it changes like your preferences, like your sexual preferences, your partner preferences, because your hormones are literally different. Like you're kind of like
Yeah,
a
I've
different
heard about
person
that.
when you're on birth
Yeah,
control
I
than you might
have.
be otherwise. Um, Certainly, the other main thing that happens, big thing, is that birth control pills will often reduce your free testosterone levels. So, like, and this is very, very common. What happens is it increases a protein called SHBG. It binds up your free testosterone. So that's your active testosterone. So essentially, it really reduces the amount of testosterone that you have in your body that is available to work. And so, like a drop in libido, a drop in desire, difficulties with building muscle, low motivation, all of those symptoms are pretty common as well with birth control because you don't have as much active testosterone anymore.
Did you know about those things when you were on? No.
I didn't know. I was an ER doctor in my first career, and I was an ER doctor for 10 years. And so, no, I had no idea. No one told me anything. And, again, I was fine. But I do look back at pictures of myself from that time period, and I was probably like 20 pounds heavier, like just kind of puffy.
Yeah.
And I don't know if that was because I, went to college and ate a lot of ramen and drank a lot of beer, or if it was also maybe because of the birth control. But I definitely feel healthier now. But I also have, it's a different part of my life now.
Yeah. Well, it was probably a little bit of a combination of both.
Yeah,
right? A little
it
bit of
probably was.
lifestyle, a little bit
It's
of
probably both.
hormones. Yeah. Hormones are so important. I try to, think about that and talk to people about that now too, because I'm like, really, we are kind of just like how we feel is like all about the balance of the hormones in our bodies.
Yeah.
Like it's kind of simple, but it's also complex. Okay. Do you have any information about cortisol and what is it doing? Do you have any thoughts on
Yeah.
elevated cortisol?
Yeah, I mean, cortisol is your stress hormone, and it can be problematic if it's too high or too low for too long, but certainly it also has a role in health. Normally your cortisol is going to kind of go up in the morning when you wake up. It's going to help wake you up, and that's a good thing. And then as your day goes on, it kind of starts to go down, and as it's low, then you can go to sleep. And that's what's supposed to happen. And what happens is a lot of times with sort of modern life is that, we're always in this kind of stressed out state, and so it doesn't have a chance to do that sort of normal curve. So either it's staying high for too long, or you've kind of like got to the point where your body stops reacting to it as well, and you're super low. But I think that dysregulated cortisol is very common, but it's really part of. It's not as simple as just measuring your cortisol. I mean, you can do that, and maybe it helps you, but cortisol is just one part of this very complex system that's involved with stress. And I call it stress overload syndrome, like SOS. Like this is, I don't know if it's a real name. I just made that up. But stress can affect every part of your body and every system. And unfortunately, we don't really have a good way to measure it. We can measure cortisol.
Because it changes all
But there's
the
so many
time.
other things.
Yeah.
And there's so many other things going on. It's not just cortisol. So cortisol is certainly a part of it. But in general, if you're feeling stressed out, even if your cortisol is normal, it's probably affecting your health in some way.
Yeah, I think so too. And this is just my own experience, is like learning to deal with stress and manage it in healthy ways, like taking a good deep diaphragmatic breath and getting myself a little bit out of fight or flight and back to here now. What can I do? What can I control? Because those when you lose sense of control and you get the anxiety, and then it's like you're feeding into this cortisol production, which, as you mentioned, it could be great if it's necessary. And it serves a good purpose.
It does. We need it.
Yeah, cortisol gets a bad rap, I think. Everyone's
does.
like, oh, anti-cortisol. No, I mean, I think it has its place. But it's just when we kind of live in that state of elevated cortisol that we see it affect all of our other hormones in kind of, a negative way.
I think it's important to think, and this has helped me a lot, to think about, stress it's a perception that we have. Like, it's not... Yes, there can be all kinds of things happening, and certainly, your life can be really hard, and I've been there too. But how we perceive what's happening around us is what sort of tells our brain that we're stressed. And so I think what you said,
Yeah.
like the idea that you're thinking about like, what of this can I control and what can I not control? And just understanding that all the thoughts you're having around, whether it's I'm stressed, this is horrible, my life sucks, I can't pay my bills, whatever it is, trying to think about like what can I control and what can I not control. And that's helped me just to say, you know what, I actually can't control how that person is acting towards me. I can't control that person, hates me, or if this is that, whatever. Like, so I think that ability to like think about what you can control is helpful in regulating stress in some people.
I think so too. I think that I wish that this was a skill that was taught in school, right? Of all
Yeah.
the other things we learn, it's like teaching people to deal with stress would be great. And it's been a while since I've been in school, so hopefully they're starting to implement that more and more for our children, because I think learning that has been, for me, life changing. Learning to focus on what I can control.
Yep.
Versus what I can't. And sometimes
And what to do about it. Like for
Yeah.
me, if I'm stressed out, I go outside and go walk in the mountains because I live on the side of a mountain. And so I'll just like leave my phone and go for a walk, and I'll talk to the mountain lions and the bears, and and I'll come back and I'll feel better. But figuring out like what is the thing that you can do that gets you get your brain in the right spot for a little while.
Yeah. Do you think that there are, like, how do I ask this? Like reasons why otherwise healthy women are experiencing hormonal dysregulations other than, our environmental factors, which is, I encourage everyone, like, look into it and pick the low hanging fruit. Like what's something, as you mentioned, that you could try to, limit. But also understanding that, your mental and emotional state and how you're dealing with these things can affect your hormones and your health.
100%. Yeah. I mean, when you think about stress, basically it is affecting your hormones. It affects your ability to make your hormones. It affects your ability to make progesterone, especially, as well as testosterone. And it's all so interconnected. And it sounds like very woo-woo to be like, manage your stress and you'll feel better. But we have so much evidence that, I think it's like 75% of diseases are either brought on by or made worse by stress. And so if we can reduce that and how we handle it, then we'll just feel a lot better.
Yeah, I think so too.
Easier said than done, though.
Oh yeah, in a busy world today, and the social media and all the great things that we have to, there's just so many things coming at us from so many different angles, and then, add motherhood on top of it. How many kids do you have, by the way?
I have 3. I have twin girls who are 17, and I have a boy who's 15, so they're kind of growing up.
I was just talking about this with another mom the other day, like twins. This is totally off topic, but how is that received when you find out you're having twins?
I was super excited. It was great. I always wanted twins, and we got them on the ultrasound. We just, there's 2 in there, which is great. But talk about stress. When they were born, those first 4 months, I've never had a harder time in my entire life. Like dealing with 2 kids, waking up every 3 or 4 hours, 3 times a night, 4 times a night. Oh, that was a rough go.
Oh, yeah. And it got better at 4 months? I didn't expect that. I would think it would start, take longer than that.
Mine started sleeping. We put them through like some sleep training at like 4 months. Because I was sleeping like 3 hours a day in like 30-minute blocks. And I was an ER doctor at the time. So I had to be at work at 4 in the morning.
Oh, my
So I was getting up at 3:30 in the morning to go to work.
Were you nursing?
I was pumping every 3 hours because the nursing went awry, but I was still pumping. So I was pumping, and it was madness. I have no idea how
you did that, but here you are.
Yeah.
Your hormones probably took a good hit on that one.
They did. That was a mess.
Okay, so tell us a little bit more about your history. You dipped into it a little bit. You were an ER doctor for, how long did you say?
10 years.
10 years? Okay.
10 years, yeah.
And then, what'd you get your degree in, and how did you move through go through all of that?
Yeah.
Did you go to college? Talk about
I was in college. I was a biomedical science major, and then I went to medical school, and then I went to emergency medicine residency. So my kind of residency training was in emergency medicine, and then I went to Austin and worked in a really busy ER in the ER. And in like 2010, my son was born. So I had 3 kids at that point, all under the age of 2. My son was born, and that next week, my husband moved out of state for a job. And so now I had 3 kids under the age of 2, and I was like the lone caregiver, and I was working in the ER at 4 in the morning.
Did you have any family in Austin, or like
I didn't have any family. We did have an au pair, so we had someone who was living with us, but she could only work when I was working. So I would go to work and then I'd come home and have them. And so we did that, I did this for a couple of years, just not sleeping well, not eating well, drinking a lot of Monsters and Diet Cokes and, all the things. And I was kind of not doing great. And I remember one day I was in the ER and I was looking out at like the waiting room of all the people who were waiting to be seen. And I just realized that if I didn't change something in my life, I was going to be one of those people in the waiting room, with some kind of chronic medical problem that probably could have been prevented, with education and some help, and that I needed to make some changes. So I decided that I was going to learn something new, and that was in 2012. And that's when, and then I started kind of, at that time, this field that I'm doing now wasn't really a thing. Like I do a lot of hormones and, I do stem cell medicine and all, sexual health and all these things. And the things I'm doing now, a lot of it wasn't even really done then. But I started learning about how to be healthy and I continued that for the last however many years.
Okay. Well, that sounds like a hell of a, like a process, like how you got there. And
yep.
What do you feel like have been some of your best takeaways in your journey in that moment when you realize like that isn't the direction I want to go. I need to do something to pivot and change right now. So, I mean, what were your takeaways? I mean,
one of the biggest ones was that I'm not like, yes, I'm in this position. I felt very stuck. I'd spent I spent years and years and years training to be this one kind of doctor. And I felt like, well, this is what I have to do. And I have a family relying on me and all this. But the takeaway was, yes, it's going to be hard, and yes, you have to kind of go out on a limb and maybe do something and not know what's going to happen, but that we can all change if we want to. Like I had this kind of like epiphany. Like, of course, it didn't happen at the time, but later that I had really I had no idea that this new field of medicine was going to work. I had no idea if I was going to make any money or it was going to work. But I realized that I didn't want to stay with what I was doing. I couldn't keep doing, this not sleeping, not eating, high stress job. So I had to change. And I think that sometimes changing is super hard when you don't know what's going to happen. But we do have more control, most of us, than we realize in our lives.
Built for growth.
Yeah, there you go. There you go.
There you are.
To plug your show.
Yeah, right. A little shameless plug there. No, but I love what you're saying there. I think that messaging is really important. And that's really what this podcast is about, is encouraging people to do that, like to take some risks, to do something hard, to grow, not stay stagnant. Don't accept a trajectory. And don't think that just because this is where you are here now and all the eggs are in the basket that you can't make a change, you can't pivot, and you can't do something great. And I don't think there's any point when it's too late to make a change.
I don't think so either. There was a guy in my medical school class who was 75 years old going to medical school. It was like his fourth career, and he wanted to be a doctor.
That's amazing.
And so he went back to school. But yeah, I think that, and the eggs in the basket is so important. I mean, you put all this time and effort into something, and you think, well, I've put all of this into it. I have to stick with it. And certainly I think that is true sometimes, but most of the time you can still make other choices if you want to.
What did that path look like for you then when you went from being an ER doctor to someone who specializes in hormones and sexual health and now, women? I know that you do take care of men too,
yes,
by the way.
Do.
But you really are a strong figure and voice for women, which I think is really needed. So thank you for your work there. But how did that journey go?
I spent several years just learning. So like in my free time and between working in the ER and taking care of the kids,
all the free time,
I would stay up late and just, do like webinars and, learn, there wasn't really a lot of, I did a lot of different sort of online learning and courses and conferences. And then eventually I quit my ER job and moved to Portland, Oregon and opened my own practice. And it was just me. It was a one-man show. It was me. And there was no one else, and I had no help. And I was answering my own calls. I was doing all my, putting my internet together, ordering all my own supplies. I was doing everything. And so I did that for a little while, and then ended up moving to Utah. And I rented some space in a med spa and did sort of the same kind of thing, like one-man show in a med spa. And eventually ended up having my own clinic and kind of grew from there. But I mean, there were several years where it was basically me just kind of taking care of patients totally on my own and making it up as I went along.
Did you know that it was right when you did that? I mean, that's a scary transition to open your own clinic and go off of this venture and be doing this all by yourself.
No, I had no idea.
At what point did it feel like, okay, this was a good decision?
I mean, it was probably years later, 3 or 4 years after I'd already gotten started. Because the first few years, I didn't make really any money. I was just kind of trying to pay the rent and trying to, figure out what I was doing, get new patients. I had no experience with advertising or getting new patients or computer systems and
not your area of excellence.
So
right?
many
Mine,
things.
no,
Running a
me either.
business like that was none of that was taught to me. So it was a steep learning curve. But I always enjoy, I really enjoy this kind of medicine. I really like the learning of it, like the hormones and the lifestyle medicine and all the things that I get to do now. And so I enjoyed that part of it. And it was, it's been a challenge, but it's fun too. I feel grateful that I've gotten to do it.
What do you feel like is the biggest difference in the patients that you would see, in the ER versus the patients that you see today, and what you get from helping those people in different ways?
Yeah. Well, I mean, I loved working in the ER because you're seeing every single thing that comes in, and you get to be the first person on the scene, and you get to save lives sometimes, and you get to, people. It can be a lot of fun, and it's a really cool feeling to work in that environment with all those people. What I like now is that I get to know patients better. Like, it's a longer relationship. My patients are generally happy. And now versus in the ER, I got spit on and thrown up on and yelled at, and, cursed at, like all the things. Now it's fun to see people come in who are maybe struggling a little bit, but then as time goes by, to see them actually become happier and healthier. I remember one of my very first patients in Portland was this woman. I opened up my clinic. It's just me. I'm greeting the patient. I'm doing all the things. I'm taking her vital signs. And she comes in, and she was so angry. She's like this 50-year-old woman. She was cursing about how the parking was stupid in the rain and just angry, like so angry. And I was like, oh my gosh, this woman. And so, but I gave her some hormones, and we talked about lifestyle and all this. And she came back like 3 months later, a totally different person. She walked in and she was like smiling. I think she brought me like a cake or something, super nice and smiling and happy. And just seeing that transition from like really angry middle-aged woman to like super happy, healthier middle-aged woman I still remember it. It was amazing.
That's so good. I feel like that would be, that would be the pot of gold at the end of the rainbow. You know what I mean? It's just like that, reaching that place where you realize like, I'm really impacting people and able to help change the trajectory of the rest of their life.
Yeah, it's pretty awesome.
Yeah. Oh, well, what are you doing now? What practice do you have? Tell us where people can find you. Anything that people should know about you.
So you can find me. I'm on all the social medias, but Dr. Amy B Killen, especially on Instagram. I do a lot on Instagram. I do a lot of education there. I have a couple of different clinics. I have a clinic that's called Humanaut, kind of like astronauts, but with humans. Humanaut Health, which we just opened in Austin this last year, and then we just this week opened in Florida as well. So we are a franchise. Thank you. We're like a longevity clinic franchise. So we do all kinds of cool diagnostics and testing, and then we do all the hormones and peptides and stem cells and all the different types of medicine.
And skin too? You do some
we do
stuff with skin?
Yeah, we do skin. We do regenerative, like skin stem cell injections.
Your skin looks great, by the way.
Thank you.
So
Thank you.
good. I need to do whatever you're doing. I mean, I got punched in the face for them, so I need to make up for some, some wear and tear.
I'm not getting punched in the face very often.
Well, you look great. I don't care if you were or you weren't. You look amazing. So I I'm listening closely. So tell me.
Oh my gosh. So I have that, and then I also have a female-focused supplement company called Hop, where we have just essentially daily packs that I created that are the ingredients that I think that most of us should take. So I have that, and then I do a lot of just educational stuff. I do a lot of speaking and travel around for that as well. So it's super fun.
It is amazing. And it's amazing to have you here today. Thank you so much for sharing all of those things. What is your website?
DrAmyKillen.com is my website, and that's my website, and then you can get to all my other clinics and projects and companies from there.
You're really fun to follow. I highly recommend on Instagram. You've got a great sense of humor as well. Like, I really like your personality on there and your analogies, and you make it really, I think one of my favorite things is that it's digestible for the average person. You know, it's not heavy. It's easy to understand. I love your analogies. I remember there's one about Superman and Clark
Kent and Superman.
Yeah. It was so good about the hormones and how they kind of work together, and it's more subtle. And so you have a great presence. You're a great voice, and I appreciate you being here today. Everybody should definitely give you a follow, check it out, and learn more about hormones and women. And I promise, guys, I hope you listen closely on this episode too. You don't have to have a vagina to benefit from helping the women around you.
That's right.
Too, and
That's right.
support and understand, because knowledge is power, and I know that once my fiance and I got aligned on my cycle, and we understand and we have more knowledge, now he's like helping out his friends who are going through it with their women. He's like, well, what time is it in her cycle? They're like, what? What does that have to do with anything?
I love that.
It's everything. It
Yes.
really can impact us. Our hormones matter, our health matters, our
Yes.
mental health, emotional health, physical health, all impacted by our hormones. So
Yes,
I
absolutely.
appreciate your knowledge and insight. Thank you.
Well, thank you so much for having me.